Hello, thank you for inviting me to this place. Where are we?
We are standing in the basement of the David Carroll, which is the physics building here at the University of Melbourne. We have our Peloton accelerator just in the room across, and we are in the control room here where all the science happens.
And what sort of science is going to happen here?
So we are working on medical accelerator technology. So we are basically building an entire new beamline for this Peloton accelerator to explore some of the concepts behind beam delivery, particle therapy, and other novel accelerator science concepts.
You are physicists, but you're doing something useful for people.
Yeah.
I didn't think that happened.
Well, I think working in accelerators, in general, a lot of the time we find that the machines are used for something, whether it's making bright light as a synchrotron, or something like in our case, where it's creating proton beams for treating cancer. Yeah. We should say that we're not going to be treating cancer here in the basement. The beam energy is much too low. Right. What we can do here is demonstrate relevant technologies and relevant ideas, which could in the future be translated to use for proton beam therapy.
Right. So there already is radiation therapy, right? So how is this different? What are you doing that's new?
Yeah, so there is radiation therapy. Hospitals all around the world basically use high energy X-rays. You can target this at tumour sites, cancer cells, in order to damage DNA to try and treat cancers. So with proton beam therapy, it's a more advanced version of radiation therapy where you use charged particle beams. So protons, helium, heavier ions. Proton beam therapy is the most common type of particle therapy around the world. Just with the way protons interact with matter and the human body, you can deliver a more localized and accurate dose to where the tumour site is.
Right. So X-rays, they pretty much damage everything in their path, right?
Yeah, so X-rays, they scatter a lot. Just characteristically, how they interact with and how they transfer energy. They'll basically transfer this energy before, during and after they reach the tumour site.
Right.
Yeah.
We should maybe also say X-ray therapy is perfectly good for most cases, and there are orders of magnitude more X-ray machines and facilities around the world than there are proton therapy facilities. There's around 100, 130 proton therapy facilities and somewhere in the tens of thousands of X-ray radiotherapy accelerators. So there's many, many more X-ray treatments available. But because proton therapy can give this very localized dose, there are some cases, for example, with pediatric cancers, so for kids, where the dose over their life might become more important, or we're trying to treat something in a very sensitive region, so like near the brain or spinal column, where it's more useful to be able to get this very precisely delivered radiation. And that's where proton therapy really comes into its own, and has advantages over
So from a physics point of view, what is it that enables the proton to be different to a photon of high energy electromagnetic radiation, light, X-ray?
Yeah, so with protons, it's the way protons interact with matter. So we have this phenomenon called the Bragg peak. So as protons traverse through, they collide with lots of different particles. There's lots of excitation and ionization events. So as they keep going, they sort of slow down. As their velocity decreases, the possibility and the likelihood of ionization events increases. So they slow down, they come to a point where they just about stop, and they deposit basically most of their energy at this point called the Bragg peak.
Right.
Yeah, so now at this Bragg peak, that's dependent on the initial energy of the protons.
Yeah.
So depending on where the tumour site is in the body, you can actually change that initial beam energy to position the Bragg peak.
Okay.
Yeah.
Sounds to me like putting in golf, that if you putt too hard, it'll overshoot the hole. You've got to get it just right so it just stops and drops all its energy into the tumour.
Yeah, definitely. And it's really this finite traversal that protons have. They don't deposit any energy afterwards, which is the benefit in treating cancers, because you don't irradiate anywhere afterwards where you might have organs at risk, as Adam was saying. Critical organs, the brain, the spinal cord, structures like that we just want to avoid, because any excess radiation can mean that you have a chance later in life at developing secondary cancers.
So X-rays just go straight through, right?
Yeah, exactly.
Yeah, okay.
You can't stop X-rays, they'll go straight through.
The name of the project is Turbo. What does that mean? What does that stand for?
That stands for Technology for Ultra Rapid Beam Operation. So essentially when you deliver treatment. So with conventional radiation therapy or with protons, you want to basically paint the tumour with radiation. So with protons, the Bragg peak is determined by this initial beam energy. So a tumour is not going to be a 2D plane within a patient. It will have a volume in multiple dimensions. So there are magnets at the last bit of the accelerator, the beam delivery system. So it's part of the transport, which directs and steers the beam towards the patient, and you can actually basically magnetically paint this beam according to the shape of the tumour.
Yeah.
And then you'll need to change the beam energy, so to paint it in terms of depth as well. Okay. So it's this time that it takes, because when you decrease the beam energy, you need to adjust all of the magnets in order to transport the next beam energies. Yeah. So there are many, many layers depending on how large the tumour is, how complex it is, and it's this time limitation which is a factor of how you design your magnets, how you design the optics, and this time limitation which can impact how fast you treat a patient. So if we can speed this up, then we can treat patients faster. In terms of motion, that increases the chance of errors, so depositing this dose in the wrong spot, so we can treat faster, less errors, as well as treat more patients and really improve that cost aspect, so reduce the cost of proton therapy.
I guess that means that you would need to know very clearly how far you need to get it, and yeah, that sounds quite tricky. Getting the formula just right to drop the energy in.
There are equations you can use to predict where the Bragg peak will lie, but in practice, the equations by themselves aren't going to be quite enough. You can imagine inside a person, it's not just all one big amorphous blob of water.
That's what I was thinking. If they'd eaten, some steel for breakfast or something, then or lead. Don't eat lead for breakfast.
Yeah, so a good example there actually is if someone eats and their stomach distends, or if they are bigger, or even if they're breathing. If their lungs, which are full of air, have more or less space in them, the stopping range of those protons will change, and that's one of the main limiting factors of proton therapy.
So there's already particle beams in place, right? So what are you doing differently?
So not everywhere has proton beam therapy. There's about 150 places around the world, and the entire process is quite slow. So we are basically trying to speed up the delivery of particle beams so that we can treat faster, and in turn that makes it more effective.
Right, okay. So how do you do it faster?
One of the major limitations for time for accelerators is making sure that's the magnets which are used for beam steering and focusing. So if you've got a big ring accelerator, the magnets which make sure your protons will keep going round in the same circle and make sure that they're well focused while they're going round in that circle. Those magnets take time to change how strong they are, and changing that strength is important because as the beam energy rises, the magnet strength needs to rise too to keep that steering constant.
In terms of the accelerators and the technology, there is this limitation of energy layer switching time, which from our perspective was purely a design limitation.
So you just looked at it and went, I can fix that?
Not really, that's why you have people like Adam.
Oh, okay. You looked at it and went, oh, Adam can fix that. So how do you go about that?
So let's imagine we have coming off on the side a beam which has many different energies in it. So it has like a large energy and a low energy, and some particles in there of, for proton therapy, maybe of a couple of hundred MeV for protons, and down to maybe 100 or so MeV protons. And they're all coming in along the same line. And when you deliver them to the patient, they also need to be along that same line again. You might have gone around a bend in between, but you need your source of your particles to be more or less a point which you can then scan and direct the relevant locations inside the patient. So in between the start and the end, we need to get all these particles round some non-zero, non-trivial bend, but get them back on the same position as they started, all on top of each other again. And that turned out to be quite hard, because it's very easy to get some particles going round in a circle, but it's very hard to get them going around in a circle starting and ending at the same point. We can imagine that the lowest energy particles will feel the strongest forces because they're low energy and they're easy to pull. So they'll travel around on the kind of the inner circuit. The highest energy particles will travel around on the outer circuit, and everything in between will travel around going in between those two. And I kind of might notice that my hands are going like this as I go around, because the particles really do. They kind of wiggle as they go through. They don't just travel in these perfectly straight lines. Inside the magnets, they bend, they move around, the beam gets larger and smaller as they go around and as they're focused. And so how do you design magnets which make the particles do these motions and do it over a very large energy range? Doing it over a small range would be relatively trivial, relatively easy, but doing it over a large energy range turns out to be quite complicated. And our project here is working on the prototyping and demonstration of the idea of going round a bend while transporting a large range of beam energies and having the same endpoint and the same focusing properties overall.
Right.
And that's quite a challenge.
Right. It's kind of like city bypasses and freeways and shortcuts.
Yeah, exactly.
For the slow ones.
Exactly. Where the bypass has it easier than us is that you can take the different cars going along different, going along different tracks entirely. So some cars might go along this part, some might go along this part, and they're totally separated roads. With us, there's just the one magnet that all the particles are going through. We can't put it down just this path or just this path. Instead, we need to design one mega magnet, one mega road, which can take all these different particles and do the right things to all of them while still being constrained by the limitations that are put upon us by physics, by Maxwell's equations, and by the kind of magnets you can actually physically build in the universe.
So is it a good thing to have a range of energies? Like, does that mean you can get some that dump their energy in the front of the tumour and some go through to the back, all in the one shot?
So the idea is to be able to transport all these beam energies with the same settings, but not all at one time, but to do that successive painting throughout depths just very quickly. So the idea, a tumour is not going to be one depth. You're going to need a range of energies to be able to cover the full depth. So about 70 to 230 MeV covers around about 3 to about 35 centimetres within the human body. So you basically want to cover that range so that you can treat all different kinds of tumours, depending where they are in the body and the size.
And why here? What makes this place particularly good for this study? What are the facilities you've got?
In terms of building a thing, you could build it anywhere. If you have an accelerator to provide the particles, you could demonstrate this idea anywhere in the world. But what we do have here, which is kind of unique, is the group. It's the people. It's the combination of the accelerator scientists and the new group that we're putting together at the moment, as well as the medical physics, the medical accelerator side of things, which we also have here. It's a collaboration, I think.
Another thing with the stuff that we're doing with Turbo is that it's quite novel in terms of accelerators, but this aspect and this concept that we're looking at has not been applied in terms of a medical setting yet. So often within our field, we see lots of design concepts, lots of projects which look at designing cool accelerators that do things that are much more advanced compared to what we see in the clinic. But to actually implement and build these ideas, very, very expensive. You need really large facilities. So what we're doing here at UniMelb is really scaling down the technology and looking at the design on a smaller scale, but we can scale it up for later in terms of clinical implementation, but really understanding the physics at a level that we can be able to understand the different challenges in building such a system and the underlying physics questions around it.
What's your kind of time frame, do you reckon? Where are you up to?
Yeah, so we're right at the start. We just got this grant last year, so we have pretty much just got our central equipment in order to build the beamline. So we've done some initial studies, design, conceptualization, simulations, but we're really right at the start of just building, so putting everything together to build the first part of this beamline.
Yeah, so you've already done some simulation work around this, so talk us through what that looks like.
So the beam starts with a large spread of energies all at one point, all on top of each other. It then starts to go through this system of magnets which separates out all these different energies, a bit like a prism for a rainbow. Separates them all out so they follow different paths. They're going through this kind of complicated arrangement of magnets which is seen around the particles they travel through. They reach a midpoint where it's kind of a symmetry point, and then everything is reversed. The particles then travel back through a mirror image of what they've already been through, and then come back to the same point with approximately the same size and approximately kind of all on top of each other at the end.
So there's a bit of symmetry, so it goes out and then comes back in. That's clever.
And because they're all parallel at the symmetry point, it's just mirrored and go back to where they started through, I guess in physics you could say time reversal symmetry or something, but really it's just like, it looks like it should work, and it does.
Excellent. Well, that's what I like to hear. Good luck for the next couple of years, and we look forward to you saving lives, physicists doing good work.
Thank you.
Wonderful stuff.
It's going to be a busy couple of years, I think, for us, but hopefully exciting.
Thank you.